Hello and welcome back to This Week in Global Health. This Week in Global Health is a weekly global health news roundup. We're making some videos using WhatsApp, so the team really just send comments and responses, etc., to each other via WhatsApp. I put them together in a video. In this episode, we're going to be talking about pneumonia. So 15% of all deaths in children under the age of 5 in 2015 will be caused by pneumonia. That's nearly 1 million deaths. Only a third of the children that get pneumonia will receive the antibiotics that they need. So I want to hear from the TWIGH team. What do you guys think? What should be done? What are the interventions that may curb or mitigate this kind of problem?
Hey guys, so in response to Greg's conversation about childhood pneumonia, I'd like to emphasize that pneumonia is the leading cause of death in children under the age of 5. In fact, it constitutes for more deaths than AIDS, measles, and malaria combined. So it's not surprising that it's gruesomely referred to as the forgotten killer of children. However, it's really important to emphasize that deaths due to pneumonia occur almost exclusively in children who have underlying disease such as chronic lung disease of prematurity, congenital heart disease, and immunosuppression. However, 95% of clinical cases of pneumonia occur in low and middle income nations. So there's clearly a disparity in the approach to care in low and middle income nations compared to their counterparts in industrialized nations.
Thanks, Sanskriti. Could you just really talk us through quickly why it is that pneumonia is such a big issue in low-income countries or developing countries?
The first reason is the lack of prevention protocols in the form of immunizations, adequate nutrition, and an emphasis on exclusive breastfeeding. The second issue is that of caregiver recognition of the symptoms of pneumonia, like cough, disrupted breathing, and poor feeding. The third issue is that of diagnosing pneumonia promptly. The fourth reason is prompt treatment of pneumonia in the form of antibiotics. And the fifth reason is the continuous monitoring of patients with pneumonia, because if they don't respond to one antibiotic, the protocol is to give them another antibiotic to see if they respond to that and to continue on that way. And so these could be the 5 reasons why pneumonia is such a big issue and causes such devastating effects in low-income nations.
Let's just talk a little bit about what's been done to prevent these deaths from pneumonia. What's happening in the world of vaccines?
The 2 common vaccines, pneumococcal and Hib, could prevent half of all pneumonia cases if all children worldwide were vaccinated against them.
So why aren't more children being vaccinated? What are the barriers here?
Well, as many would guess, cost is a major factor. Now, the cost of vaccines are quite high, and then also the cost of getting the vaccines out and having a supply chain and an immunization system to support that is costly. And a lot of low and middle income countries just don't have strong immunization systems.
Okay, so we know cost is an issue. It seems always to be the case. What else can we do? What else can be put in place to help save lives and prevent these pneumonia deaths?
Another way that we can reduce the cases and also the deaths of pneumonia is having a better system to treat and a more integrated system. So an approach is integrated community case management, ICCM, and it looks at getting treatment out to the communities beyond just the health facilities, and it uses community health workers to reach much broadly and to diagnose and treat children with childhood illnesses. Pneumonia, malaria, and diarrhea are usually the common ones, and it has been an effective strategy to deliver high quality treatment and early treatment to children and prevent or treat pneumonia.
Okay, super duper interesting. We all know a little bit more about pneumonia now. Thanks for watching. This has been This Week in Global Health. Remember, you can get us on Facebook. We're on LinkedIn. We're on Twitter. We're all over the internet, on Google+, on YouTube. So keep in touch. Remember, you can respond to these videos, put comments in the comment section, get us using the hashtag TWIGhteam, or of course, you can get us at our webpage, www.twigh.org. You can email us at hello@twig.org as well. Okay. Thanks for watching. Don't ever change. Don't do drugs. Always do your best, and we'll speak to you soon.